Welcome to Conversation with a Geographer. I'm Mike DeVivo, Professor of Geography at Grand Rapids Community College. And today we have Jonnell Robinson, who is Assistant Professor of Geography at Syracuse University and also Director of Community Geography at Syracuse. Jonnell, thank you so much for joining us today.
Thanks for having me.
Oh, you're very welcome. We're really excited about your talk tonight. I guess as I start a number of these conversations, I'll ask you, as you reflect upon your past, can you think of any particular moment that inspired you to become a geographer?
Yeah, there's a few. I did some field work for my master's thesis project when I was studying public health in Ethiopia, and I had come across a team of researchers who were mapping HIV hotspots for transmission, and I was very intrigued by this approach using mapping and GIS technology to help in public health prevention campaigns. So that was really the first time I had ever been exposed to geography and geographic techniques. And when I finished with my master's, I came back to UNC and started taking geography courses.
And so you continued to take geography courses in medical geography?
Yes.
And tell us a little bit about your path toward research in medical geography, if you don't mind.
Sure. Well, I wanted to continue the work that I was doing in Ethiopia when I started the geography program, but I wanted to try a different region. I had worked previously with World Wildlife Fund and had spent some time in Latin America, was able to travel in Africa during my thesis project, so I decided that I'd like to work in India for my dissertation project, and I spent a year learning Hindi and spent 3 months in India trying to put together a research project that would look at some of the community causes and consequences of HIV and tuberculosis co-transmission in particular. So I was really interested in those ecological factors that contributed to disease transmission.
And that field work didn't really work out well.
It did not. There was a number of things that started to come undone. I had a difficult time getting my research visa to go back to India. And that year there was an unseasonably bad monsoon that was very detrimental to the slum communities outside of Mumbai that I was working in. So I was at this crossroads where I had a research project that was starting to fall apart and needed to decide what I would do to continue on with my studies.
And from that point, you really didn't know.
I didn't know. It was summertime, and I was studying for my comprehensive exam and trying to figure out what I should do. And all the while, my advisor said, you know, I told you so. When I first told her that I wanted to work in India, she called me into her office and had wrapped a red ribbon around a huge stack of papers and said, if you want to work in India, this is what you're going to be dealing with. A lot of red tape and bureaucracy. And so she proved to be right in the long run. And eventually I had to decide that I needed to find another project and do something different because it was probably not going to work out.
So you completed your exams, and Syracuse had an advertisement.
Yes, so right around that same time when I was doing some soul searching about what I was interested to do, I received an email, like all of my other cohort, from the chair of our department, which was forwarded on from Don Mitchell, who was then chair of the geography department at Syracuse University. And they were looking for someone to come to SU to be what they called a community geographer. And it was a staff position, and that person was supposed to work at the university, but in partnership with representatives from the community on a variety of different geographical and geospatial challenges. And so I was very intrigued by the job ad when I saw it, but I was in the middle of a dissertation, I was in the middle of a PhD program and thought, well, this is a really interesting opportunity. It's right up my alley in terms of my training and what I'd like to do eventually, but the timing is off. So I ignored the job ad for several weeks until it actually had the deadline to apply had come and gone, and then decided to write to Don and explain my situation, tell him where I was in my program, and ask if it was still possible to apply.
And his response?
His response was, you should definitely apply. It sounds like you have the skills and the experience that we're looking for. And, you know, assuming you would be the person we wanted to offer the job to, I'm sure we could work something out so that you could continue and finish your degree. So a few weeks later, I flew to Syracuse. I had a couple of day intensive interview and left thinking, this is great. I would love to do this. They offered me the job, and I soon thereafter moved to Syracuse.
Do you recall what some of the first projects were that you engaged in community geography at Syracuse?
Oh, most definitely. They had started working with a coalition of organizations that were working to alleviate hunger in the Syracuse area. So when I was hired, that was one of my first projects, to continue on with the work that had already been started. In addition to that tax season, the United Way was rolling out a new program to help people have their taxes prepared for free at volunteer income tax sites. Through the analyses that had already been conducted, they had learned that fewer people than were eligible were taking advantage of the earned income tax credit, which can be very influential in a low-income family's finances. So I did some help mapping out where we should have the free volunteer income tax preparation sites. And the other early project that I worked on was with a coalition of organizations that were trying to prevent sexually transmitted diseases among youth in Syracuse. We, at the time, had some of the highest rates of syphilis and gonorrhea amongst young people. And so I helped
Highest rates in the country?
Yes. And so I was working to help them map out the prevalence rates of a variety of sexually transmitted diseases, and then again also strategically think through where might be the best geographical places for interventions, and how we as a community could do a better job of preventing such illnesses.
As a consequence of your mapping in reference to interventions, do you know what the results might have been? Did it have a positive impact?
Yeah, so from there, as is usually the case with the projects that I work on, when we try to answer one question, it leads to many other questions. And the further we got with that particular project, we realized that as a community, it was very difficult to know what types of youth services and youth programming was available. And that is seen in the public health community as being really important to preventing sexually transmitted infections, making sure that youth have a supportive environment, they're involved in a variety of extracurricular activities, have safe spaces. So we embarked on a citywide campaign to survey every nonprofit and every grassroots organization that we could get our hands on to figure out what types of youth services they provided. So we ended up surveying close to 300 different organizations and had nearly a 100% response rate, I think mostly because folks knew how important it was. And we ended up creating a very thorough youth resource guide. It was all online, it was interactive and had a mapping component. So not only would youth, but also folks in the school district and social service providers would be able to see what was available in a variety of youth neighborhoods.
You also did some work in mapping teenage pregnancy, didn't you?
Yes.
And if I'm not mistaken, there was a problem, wasn't there, in terms of how data had been collected before? Most of it was restricted to schools. Could you explain that for a minute?
Yeah, as best as I can remember. I'm impressed that you have, that you know about that. So we were trying to map teen births. You can't map pregnancies because not every pregnancy results in a birth. So we were working first in our region, but also across the state, using birth record data to figure out where we saw high prevalence of teen childbearing. And typically those data are not made publicly available. They're not shared. They're very protected by HIPAA regulations, and rightly so. But there are clauses in those types of legislation to provide access to data if the analyses will help better health outcomes. So we were able to sign a data sharing agreement with the health department to gain access to those data and help provide some of the first maps that showed where we had higher than average rates for the state with regard to teen childbearing.
Did your public health background help you in your analysis of this?
Oh, for sure. And I think that's why many of our early projects were very health related. People in the community knew that I had a public health background, and I think it was helpful for me to bring insights. My focus area was maternal and child health, so I felt very prepared to have conversations with our former commissioner of the health department and others about the types of analyses that might be needed to help design better intervention programming.
Now, can you explain how this position, community geography, developed? Because it was the first position in the United States, really, to develop like this in academic geography, isn't it?
Yes, that's right. Well, after the analyses for hunger had been conducted prior to my being hired, many members of the community thought that it would be very helpful for the university to hire someone full-time that could be available for this type of research assistance. And the university at the time was also intrigued by the idea. We had a chancellor who was very much committed to what she called scholarship in action, and that was a mission to engage our university faculty, staff, and students in our immediate community. So the stars were really well aligned. We had a very supportive chancellor. Our department of geography was very supportive. And this idea emerged from the community. And so folks on campus thought, yes, we agree. We'd like to start something like this.
And so it developed, and the geography department really spearheaded this initiative for a community geographer. And perhaps the influence of Don Mitchell was very significant in this endeavor. He served as your mentor, I guess, in terms of your early years in this project. And you comment about ways in which he assisted you and what you might have learned from him.
I've learned so much from Don, and he has since left Syracuse University, and it's taken a good deal of time to get used to his absence. But when I was first hired, he was instrumental in helping with the fundraising. He helped negotiate with the university and also helped write many funding applications to our local foundations to fund the work that we did. He helped to explain what I was doing to the rest of our department. The geography department at Syracuse is historically pretty theoretical, and I think there were several people that didn't understand what I was doing there and how that could benefit the department. So he often, acted as the ambassador for the program and helped smooth the way so that folks knew what we were up to. He also helped form a steering committee. When I was hired, we thought that it would be advantageous to have both members of the community, representatives from foundations, grassroots groups, social service organizations, as well as members of the university, meet on a regular basis so that everyone knew the types of projects I was working on, and then we could vet those project requests together. So he was an active member of my advisory board for the entire duration of the program until he left. So there's just a number of ways that he was very influential and instrumental. When we decided to create a faculty position, and I moved from being staff to faculty, he also wrote the job description and helped advertise it and helped turn that into a faculty position, which is relatively rare. It's rare that someone would start at a university as a staff person and then move into a faculty position.
Especially in an institution that's R1 like Syracuse.
That's right.
the way in which the position developed is very intriguing. Before we look at some other community geographer positions that you're aware of, can you comment on how assessment of your role as a community geographer, as a faculty member, is different than others on the faculty in geography?
Yeah, so most faculty at Syracuse and other institutions have a 40-40-20 load. So they spend 40% of their time teaching, 40% doing research, and 20% of their time doing service. When we created my position, we decided to divide my time a little bit differently. So we devoted 65% of my time to research, but the majority of that would be doing community-based and participatory research. A lesser service load, I think it was about 15%. Because I do so much service in the community, which is very instrumental to doing the projects that I do, I had a lesser obligation to do departmental and university service. And I also had a lesser obligation in formal classroom-based teaching. Through Syracuse Community Geography, we have an internship program where students work on an hourly basis, they're paid, and managing a small team of interns is pretty time intensive. So we wanted to make sure that I had the ability to focus on that. And so I teach typically, and it varies, one formal course a year, whereas my peers teach 2 formal courses every semester. So my position looked very different. And because we were concerned that one day a tenure and promotion committee might not understand why my position looked so differently, why I had different outputs, we created a memorandum of understanding that laid it all out as clearly as possible in writing. And we had our departmental chair, the dean of arts and sciences, and the dean of Maxwell School, and the provost's office all sign that memorandum. And so at all of the stages of evaluation, that memorandum is on top to remind people what I was hired to do and why my position looks different.
And the research product is, in essence, a series of different reports and website, different, well, it is the same website, isn't it? But there are different projects that are posted on the website and maps posted on your website that the community can examine, noting the impact of your research, which is quite different than a colleague who might be deeply immersed in a theoretical aspect of our discipline, whose work product might be seen in a refereed journal, but not by anybody in the community, and not making an impact on people in the community. Is that fair to say?
Well, I can talk specifically about my outputs and products. I do have a website that does host the products of everything that we've ever worked on. Transparency and public access to information is really important to us in the program. There's also an interactive mapping web tool that didn't exist in our community. We do have an online mapping tool through the county that provides some very basic land tenure data, but didn't provide things like analyzed census data to show where poverty rates might be highest or the locations of many of our community resources. So those were 2 focal point products of our work. And excuse me, and then with the individual projects that I work on, most generate a report in the end, or maps, or presentations. And then, to a degree, there's also a level of awareness that's been raised, or members of the community that have been empowered to take this information to create change in however they define necessary, which is a little bit harder to evaluate and monitor. But one of the other things that we did for both my 3-year review and then also my full tenure review at 5 years was to solicit evaluations from members of organizations and coalitions that I had worked with. So it wouldn't just be faculty peers at equivalent universities looking at my case, but members of the community, including City Hall, for example, would comment on the projects that I had worked on and the impacts that they felt had come about.
Well, this type of participatory research is certainly it seems to be imperative, really, to enact pragmatic policies to affect change in an urban area especially. You found yourself, though, sometimes discussing matters with public citizens and then with officials in City Hall, taking a side, not taking a side, acting as an intermediary. What were some of the difficulties that you had in engaging in facilitating that kind of dialogue?
Well, for the most part, I try to remain neutral in the types of projects that I do, because some of the groups that come to me for assistance know that as an activist organization or an agitator, if you will, that they have difficulty getting in front of the right audience, the policymakers or those who can make change. So I tried to provide as much as possible objective analyses that could be used and serve as more of an objective voice that says, you know, when I look at what's going on, this is what I am coming up with, and is it possible for us to start some kind of dialogue that will lead to change?
It seems like you must have to have a knack for developing relationships with people from all walks of life. Do you have any advice for others to do the same thing? How can you engage in dialogue with people from all walks?
Well, I think as far as the projects that I work on are concerned, the folks in the community who bring those projects are experts. This is their domain. It's the type of work that they've been engaged with typically for a number of years, but they're interested in a fresh perspective or looking at things in a different way. So I think the first and foremost important piece of it is understanding that everyone brings something to the table and that I don't have all the answers and that I'm not the expert. So I think most people that I've worked with would say that they find me approachable in that way, that I don't tend to cast judgment and I'm a good listener, and that I like to hear all sides of the story and figure out, you know, what we can do based on the information that's available. So facilitation and good listening skills, I think, are really important.
I can imagine. Do you know if the other departments of geography that have established community geography positions, do they follow the model that essentially you pioneered at Syracuse?
To a degree. I think it has to be adaptable to the context in order for it to work successfully. So there are modifications, but for example, programs that had started in Georgia State and at Columbus State University in Georgia both used similar project request forms, for example, and provide a similar vetting strategy for the different projects that they receive, and similarly engage students through their classes or outside of the classroom in experiential learning or independent studies projects. So there are a number of similarities, but because funding is different at all schools and because there are different commitments, their staff or faculty involved do things a little bit differently.
I see. This is really the ultimate position, really, for an academic to engage in applied geography, one would think, because you're continually attempting to resolve problems in a local community. Do you see this field growing?
Well, right now it seems to be growing because of the number of universities that are hiring people in some capacity to do this kind of thing. It's not new to geography. I think we have a long tradition in doing applied and pragmatic research. So I think that this is just providing evidence that it can be institutionalized and that it can be beneficial to teaching and learning as well as the university and to the general community.
Mm-hmm. It must be difficult to engage in all that you're doing and still raise 2 children and be a vibrant member of the community. Do you have any advice concerning how one can do that? Others in your shoes?
I have no advice, but I should probably be seeking advice. No, I mean, I think our kids, they're 6 and 7 now, are following in our footsteps. My husband is also very involved in the local community. They just participated in the March to End School shootings this last weekend, but they've sat through more than their share of community meetings if we don't have babysitters, and they have a pretty good understanding of what we do, and they're forgiving, I'll say.
They've been indoctrinated into the importance of social justice, I guess.
Yes.
Very good. And lastly, you know, there are a number of students that are interested in doing this kind of work, being involved in the community as geographers, professionally, academically. Do you have any words of advice for them?
I think it's so critical that anyone who can get involved in any way that they can. We, as a society, are facing a number of intractable challenges, and geographers in particular have a really unique skill set and theoretical training to be able to contribute to those challenges. And civic engagement is so important at any level. So with my students, I encourage them, whatever they go off and do, they don't have to be involved in academia, they don't have to have a job title that has geographer in it, but there are a number of ways to get involved, and I encourage them where they settle to go to their local community and neighborhood meetings, to get involved in local politics, but to be engaged and find a cause that speaks to them. Because if we're all involved in some capacity, I can't imagine that we won't be able to make good change.
Jonnell, thank you so very much, and thank you for what you're doing for geography.
Well, thank you for having me.